Hi, Dr. Larry Altshuler here, talking to you about healthcare and healthcare reform. Telling you things that you will not hear from the media, and you certainly won't hear from the politicians. Now, in my last video, this was the first one in a series of 3, talking about the dysfunction of our present healthcare system. In my last video, I talked about a major problem that underlies our dysfunction, and that is waste. We waste a tremendous amount of our healthcare dollars, up to $1 trillion a year, with unnecessary and ineffective treatments and tests and procedures. And I told you that most of this waste came from technology and came from a shift to a specialty system with specialized care for very many reasons that I already said in the video, and you can find in my website. So we're going to go ahead with the second part of this series and talk about that waste and why we can't get rid of the waste. Because as I told you in the last video, we not only are not doing anything to get rid of this waste, but we are actually supporting the waste. We're reinforcing the waste. Now this really kind of throws you going, well, how are we doing that? Well, let me just tell you a term which is very important. Standard medical care. Now, the point is that everything that we do in healthcare and that is paid for in healthcare is considered to be standard medical care. Now, you would think, okay, if it's standard medical care and it's being used, then it must be good. But in fact, you'd be wrong on that. In fact, most of the standard medical care in our system is actually unnecessary and or ineffective. In fact, studies have shown that up to 90% of what's considered standard medical care is actually not based on scientific data or research. Up to 90%, and that's a lot. Now, I'm not telling you that all the standard medical care is unnecessary and ineffective, because a lot is, even if it hasn't been backed up by research. But there's a tremendous amount that is, and that is simply wasteful. Standard medical care does not mean that it's going to work, that you're going to have good outcomes. It simply means that's what's being done out there. And unfortunately, a lot of what's being done out there is totally wasteful. Now, you can say, well, okay, you know, these medical providers, the hospitals, they do all these procedures and tests that are wasteful. But of course, if they didn't get paid for this waste, then they probably wouldn't do that. I mean, that's obvious. But that's the problem, because in fact, we keep promoting the waste because it keeps being paid for. So what's going on here? Well, the answer is that we have entities that pay for all this health care. There are 2 major entities. They're called the third-party payers. The first and the largest is the government, including Medicare. And the second is health insurance companies. These are the entities that pay for all our health care. So they're the ones that are paying for the waste. And it is well recognized. They pay for more care, more complicated care, and more invasive care. And yet they don't pay for the more appropriate, effective, and efficient care. It is well known they preferentially pay for specialty care and technology over other more cost-effective treatments. And that's a real problem, because as long as they keep paying for this waste, we're going to continue to have that waste. So what's going to happen is they may pay for surgeries and tests that cost thousands of dollars because it's standard medical care, and yet other cost-effective methods and alternative methods that are just as effective won't be paid for because they're not considered standard medical care. They're not done by the major medical community. That is the major problem we have today. We have the waste, and that waste is being paid for. Now, in my next video, which is the last video of the 3 videos on our dysfunctional healthcare system and the waste in our system, I'm going to tell you why this is not going to be able to be reformed. You would think that knowing all this, we could change the system and get the third-party payers not to pay for waste, but that's not true. And it has to do with who has the control and who has the power. And what you'll see is that those people are not going to change things. So go ahead and see my next videos. You can go to my website, balancedhealing.com, and find all these videos. You will also find an amazing amount of information on how to avoid all this waste and how to find the treatments that are necessary and that will actually help you out. Until then, thanks for tuning in, and I hope you come back and see my other videos. Thank you.